Mr. Speaker, I would now like to yield to my friend and colleague, the gentlewoman from Texas, Ms. Eddie Bernice Johnson.
Thank you very much, Mr. Speaker, and let me thank our Congresswoman from Ohio, Congresswoman Furge, for organizing the order on health care. Over the years, the degree of accessibility and quality of health care in the United States has faltered. We are a nation in crisis. Many Americans who are uninsured and unable to pay their hospital bills are deprived of the care and attention needed to ensure their well-being. Fundamental change is necessary to truly make progress toward a healthier American. We must rescue our health care from the insurance companies and the pharmaceutical companies. My experience as a state and federal legislator and a nurse have provided a unique vantage point from which to discuss this issue. During my 15 years as a professional nurse and that of a chief psychiatric nurse at the Veterans Administration Hospital in Dallas, Texas, I witnessed the diminishing state of our health care firsthand. Our system of health care is especially weak when it comes to mental health, for example. Individuals with mental illness do not receive sufficient coverage from insurers. While some are uninsured and unemployed, others may make too much to qualify for Medicaid. The limited options that our healthcare system offers mental health patients result in their inability to obtain appropriate treatment. Some years ago, in the state of Texas, there was a lawsuit, and the ruling came down, said patients had a right to treatment. Many of the patients that were in state institutions were discharged because we did not have the staff to treat them. Guess what happened to them? They became homeless, and many went to prison. They become victims of our flawed health care system, become unable to gain employment, and at times really have no other place to go but to the sidewalks and the streets and the doorways. People with mental illness are amongst those least served by local and national health care systems. Individuals and families across the country are being affected by the faults in our care system. Thousands of families are crushed by the growing cost of health care. Today, Americans are spending more on health care than housing or food, and they sometimes must choose between paying their health premiums or their rent or even their prescription medications. With our ailing economy, Americans should not be forced to make that choice. And now is the time for reform. We must not allow these millions of dollars that are going to lobbyists to distort this plan win this time. We can reform our health care system by improving and expanding our current systems of Medicare, Medicaid, and CHIP, making them available and affordable to all Americans. I don't think we ought to have a total federal or a government plan, but we ought to have a choice, because the insurance companies have no one to compete with now, and they can charge what they want and limit what patients can get. They are dictating to doctors what they should order. That needs to end. We need a guarantee and provide quality and affordable health care to all. We need to ensure that care is patient-centered and accessible, setting higher benchmarks for quality and efficiency. We need to enforce rules that make sure our insurance companies put health care over profits. They've had their day. Americans should be able to keep the health care that they have, but also have the option of a public plan that does not leave anyone at the mercy and fate in order to stay healthy and avoid bankruptcy. We can take the best of our current models, lessons learned, and use that to reform our health system. 46 million uninsured Americans, including 5.7 million in Texas, are in great need of health care coverage. Many of our uninsured in Texas are working people. We need to act now to reduce health care costs as well as health care disparities. to ensure the well-being and the healthiness of all Americans. This country we call the leading nation and the richest country do less to make sure that the people here, the citizens, are healthy. We must change this now. We must not allow millions of dollars going to lobbyists, distort this, and defeat it this time. Thank you.